The peer review benchmarking. Healthcare providers can measure the quality of their services by comparing their performance to that of peers or benchmarking against established standards. That we can get it from the NICE guidelines, often serve as benchmarks for quality in the UK. Patient and public involvement. Quality measurement can also include gathering feedback and input from patients and the public. This involves assessing patients' experiences and satisfaction through surveys and consultations. Cost effectiveness analysis. The NICE guidance may also consider the cost effectiveness of interventions and treatments are part of the quality measures. This involves assessing whether the benefits of treatment justify its cost. Yes, so it's important that we check that the benefits that of treatment that we give, the cost people pay, is it proportionate? Are they fair? These are things that we need to consider. So in conclusion, measuring quality in health and social care involves comprehensive approach that includes clinical guidance, quality standards, performance indicators, patient reported measures, clinical audits, peer review, and the public involvement. The NICE plays a central role in providing guidance and recommendations for measuring quality in the UK healthcare system. One of the references that we can look at is the NICE, National Institute of Health and Care Excellence 2021, NHS Digital 2021 Performance Indicators, and then Culture, ALOC, and ZIP. We have collecting data on patient experience is not enough. They must be used to improve care. Then we have the how to evaluate approaches to implementing quality systems. We have what we call the TQM, which is the total quality management. It's a comprehensive approach that emphasis on continuous improvement, customer focus, and employee involvement. It has been widely used in healthcare to improve processes and patient care. The TQM can be effective in enhancing quality, but it also requires a significant cultural shift and long-term commitment from healthcare organizations. Then we have Six Sigma, which is also a tool that we use in identifying quality. The Six Sigma is a data-driven approach aimed at reducing defects and errors in processes. It has been applied in healthcare to enhance quality and reduce medical errors. While Six Sigma can lead to significant improvement, it may involve extensive training and resource allocation. Then we have lean management. Lean principles focus on eliminating waste and improving efficiency in process. In healthcare, lean methodologies can reduce wait times, improve patient flow, and enhance overall quality. However, implementations may require significant changes in workflow and culture. Then we have the ISO 90001, which is Quality Management System. The ISO 9001 is an international standardized organization that recognizes quality measurement systems. The healthcare organizations adapt to this standard to improve the processes and demonstrate their commitment to quality. ISO 9001 certification can enhance the reputation of healthcare providers, but it may also involve substantial documentation and auditing. We can get a reference on International Organization for Standardization. International Organization for Standardization, which is 2015. The Baldrige Performance Excellence Framework. The Baldrige Framework provides a structured approach to organizational excellence. It encourages self-assessment, benchmarking, and continuous improvement. Healthcare organizations that adapt to this framework often achieves high levels of quality, but the process can be resource intensive. You can get this from the Baldrige Performance of Excellence Program 2020. Then we have to look into regulatory compliances. In some cases, quality systems are implemented primarily to meet regulatory requirements, such as those set up by organizations like the NICE in the UK. While regulatory compliance is essential, it should not be the sole focus for quality improvement efforts, as it may not address all aspects of quality. April 2021. The patient-centered approach. Regular emphasis on patient-centered care involves engaging patients in their care decisions and treatment plans. This approach can improve patient satisfaction and outcomes. However, it may require changes in communication practices and a shift in the healthcare provider-patient relationship. Epstein and Street 2020-2021. Continuous feedback and improvement. Regardless of the specific approach, continuous feedback and commitment to improvement are essential. Regular collecting and analyzing data on quality indicators and patient feedback are vital components of any quality system. The Lithians and L2 2012. So are you there, Tofel? Robert, are you there? Tofel, are you there? Tofel?
Yes, sir, I'm here. Sorry, the mic was mute.
Okay, you need to. Okay. So there should be continuous feedback from the staffs and from management to help improve what we call continuous improvement, because regularly collecting and analyzing data on quality indicators and patient feedback are vital components of quality system. In conclusion, we say the choice of approach to implement quality system in healthcare and social care should be tailored to the specific needs and circumstances of the organization. Each approach has its strengths and challenges, and success depend on factors such as leadership commitment, resource allocation, and willingness of staff to embrace change. References, we can refer to some of these references as well. Then we have to look into some of the barriers that becomes a problem delivery of quality of care. Analyzing barriers to delivery quality of care services is essential to identify and address the challenges that can hinder the achievement of high standards of care. Those barriers could be complex and multifaceted, impacting various aspects of service delivery. In this analysis, we will have to examine some common barriers to the delivery of quality of social care services and provide references in the Harvard reference system for further explanation. Resource constraints. You may have resource constraints. You may not have a lot of resource, and that may not help in the delivery of quality system. Insufficient funding can result in lack of essential equipment, facilities, and qualified staff. Well, you don't have money to employ qualified staffs, and that can also be a problem. And then we have the workforce challenges. Workforce-related barriers include issues such as staff burnout, high turnover rates, difficulties in recruitment, a stressed or demotivated workforce can compromise the quality of care. That can be also a barrier. Then fragmented care. Fragmented care due to poor coordinating among different healthcare providers and service can lead to gaps in delivery. Patients may receive disjointed or duplicated care, impacting their overall experience and outcomes. So if the care packages are not well coordinated, or you don't have a care coordinator that coordinates that with the staffs on the ground, it becomes a problem. It becomes fragmented. Then we have to look at the health inequalities. There might be socioeconomic disparities and unequal access to healthcare services can lead to difference in health outcomes. Vulnerable populations may face barriers in assessing quality of care, leading to health inequalities. When people tend to struggle to access the healthcare, could be distance and other that equates inequalities within the healthcare, lack of information sharing integration, inadequate information sharing and integration of health records among healthcare providers can impede effective communication and collaboration. This can lead to errors, delays in treatment, and compromise patient safety. Then we have the regulatory burden. Excessive administrative and regulatory requirements can divert resource and divert resources away from patient care and increase the administrative burden on healthcare providers. This can negatively impact the quality of care and contribute to the burnouts. Then we have resistance to change. Obviously, there will be problem with change management. If you bring any new practice, will definitely have some oppositions or resistance. That's what it's talking about. Complex healthcare system can also be a problem in terms of the barriers that we have to look into, because that may involve quite a number of bureaucracies and things that you have to go through to be able to have a quality of care world nurtured. Inadequate patient engagement. Failing to involve patient decision making can also be a barrier to quality of care or the strategies that you want to put in place. And patients are involved in their day-to-day activities. It enhances quality and it also allows for collaboration and continuous improvement. Then we have to look into the public health emergencies. Public health emergencies such as pandemics can overwhelm healthcare systems and disrupt the delivery of routine care. This can strain resources, impact the quality of services. Okay, then this will be some of the conclusions. So in references, we can look at the references here. And then what we did today is we had global lessons in building a continuous improvement culture in healthcare. You can get it on your model. The care act guidance on strength and basic approaches, you can get that on your model. Privacy and dignity in care, you can get that on your model. And any other questions, you have to email us so that we could refer you back as well. On your final day of your assignment discussion, you are supposed to submit your assignment 2 weeks from when we have the assignment discussions or your last lecture. Okay.
Sir, when will we have assignment discussion again? Because I had a few papers in the previous week, so I gave them. Before starting the assignment, I just wanted a brief view of the assignment.
Okay, so is it for this particular lecture, you mean?
Sorry, sir, I couldn't understand you. What did you just say?
For this particular lectures, you mean, for today's lecture?
Yes, sir.
For today's lectures or for previous ones? Is it for
No,
today's
sir, you
lecture?
can just tell me in a brief module that how to just make it, headings and all and stuff. I just want a brief because sir gave the class, I remember almost, I think 2 to 3 weeks ago, and I had a few exams in the previous weeks. So my sole focus were on that exams. So I just need a brief intro, or you can say of that, how to make it, and then I'll start doing it and submitting it to you guys.
Okay, so have you started any at all?
No, sir, my paper just finished this week, so I'd start now. That's why my classes in between were also missed.
Okay, this one. Okay, so this see the
Okay,
screen.
sir. Yeah.
So these are 3 learning outcomes. Okay.
Okay, sir.
First, second, and third. We just did today's one. The assessment criteria, we expect you to assess the relevance of motivational theories to organization performance in health and social care. That's the learning outcomes, okay? You should be able to
Yes, sir.
explore factors influencing motivation and performance in health and social care sector. 2.3,
Okay, sir.
you should be able to analyze the impact of performance management on the successes of the health and social care organization. And then lastly, you should be able to analyze how own practice supports a positive culture in the organizations. So I'm sure we've done this one, we've done 1, we've done 2, and the last one is a 3. This one, okay?
Okay, sir.
And these are the instructions. Prepare a report. The first one has to prepare a report for stakeholders in which they analyze the stakeholder theories, and then it shows that delivery should be one report, 3,000 words excluding TOC. You get all this in your model. Okay, you get all this in your model.
Sorry, sir.
You should have all this info in your student model. Your
Okay,
student
sir.
model. Are you able to log in your model?
Sir, I can't hear you.
Are you able to log in your student model? Do you log in?
The app you're talking about?
No, your student model, your students portal.
Sir, I'm not sure what you're talking about. Can you please spell or
Your
write it
student
in the group?
portal where you have all your assignments.
Students
Don't
portal?
you have your login details?
Sir, I have my login details for the app, but I'm not sure what you're talking about. Let me see. Sir, Moodle.
Hello? Hello? Hello?
Hello, sir. Can you hear me? Are you talking about
Oh,
Moodle, the app?
yes, yes. You know that, don't you?
Yes, that's what I was talking about, the app. I have my login details of that.
Yeah, that's what I'm talking about. So you can get all this information on your app or student model, okay?
Sure, sir.
All right. Any questions?
No, sir. If I have any queries, we can discuss that in the next lecture. I think it's on Thursday, Friday, if I'm
Yes,
not wrong.
please. Yes, please. Okay.
Sure, sir.
All right.
Thank you.
See
Yeah.
you then. Take care. Bye-bye.
Okay. Take care. Bye.
Bye. Bye.
Bye. Bye.
One question. Question.
double check it.
Comunque, in realtà non tiene parte di acqua, sai, non dico. Anche mi dice, mettere le parti, io non vedo, no,
Vabbè. Oh no, yeah, yeah.
per mi fa,
Ah,
per mi fa, io devo andare un po'.
come fate che... Oh, dobbiamo ancora avanzare.
Questa persona non vedi, quindi si poco ne da mi si appetta me anche per perché
Amico là non insomma, ancora avanzare.
per proprio anche di TV so ma no quando come gli access
Non sa neanche. Sta neanche per me. Cosa è? Proviamo a me.
vedi
Guarda. Oh, Sally, we have to go to the bakery place and meet you online. Which was see 6:30. 6:35.
I mean
6, 9, 3, 1, 2, 7.